consult, or any consult for the matter, it's really medication history, surgical history, allergies, medication reconciliation that we're doing for every person that comes into the center. For somebody specific with peripheral arterial disease, they have to get a physical assessment of the legs. And that's really the most important thing. It really gives us a story. We look for pulses. There are two pulses that you can really feel and hear. You're supposed to feel them and hear them with a certain quality that we look for. And we use a handheld Doppler. It's almost like a miniature ultrasound machine. And we put that over the arteries and we listen for it. We listen for a particular quality, a particular strength. And if you don't meet that criteria of what our trained ears can really hear, we would then send you for either an ABI, which is an Ankle Brachial Index. It's a test that checks the blood pressure in the arms versus the blood pressure in the legs. And the blood pressure in the legs are supposed to be slightly higher than in the arms. However, if there is a major gap in between and it tends to be much lower in the legs, then we know that there may be a problem with the blood flow, the circulation going down to the legs. We then would do an ultrasound for both legs, or the one that is typically symptomatic. And we're just really looking for any blockages, any narrowings, anything inside of the legs that would then be considered peripheral arterial disease. We do the ultrasounds in center, which is great because it's very convenient for the patient. So everything is done right then and there. We ask you everything for the consultation, all of your symptoms. We check your pulses and the ABI if needed, and we send you for the ultrasound that day. So you're able to really get an entire story. We come back, we give you the answers that you're looking for right then and there. So that's the beauty of doing the consultation. You could really find out exactly what's happening. If it is something that is peripheral arterial disease that you're suffering from, you get that answer right away. There's no waiting. You don't have to wait for any kind of results to come back, because the physicians, they're getting the answers right away from the ultrasound itself. After you've gotten the information as to whether or not this is peripheral arterial disease, you get some options. There are definitely some different ways, different directions you can go into to determine whether a procedure is best for you. We do discuss the procedure with you itself, answer any questions there, and set you up for the procedure that day after obtaining blood work. So we even do that in the office. So for somebody that's really suffering with it and they do want to move forward with a procedure after they've gotten their results, after they've gotten their options, we're able to take blood on site. So everything's done right there. And that's, like I said, the beauty of doing the consultation. You get your physical examination, you get all of your preoperative testing right there on site. We tell you what to stop, what kind of medications to stop, what medications to continue with prior to doing the procedure. So it would really be just waiting on any kind of insurance authorizations, which may take a couple days, but we can get you in pretty quickly for a procedure to help those symptoms.